behind the curtain. I'm good. Good. How are you? Doing all right. Ain't nothing like making sure stuff don't blow over.
One thing that
I thought about it. I was like, that was my brain.
If I start crying.
Thank you. I'm sorry. I know people don't go. I'm like, yes,
I'm giving you permission not to say that anymore if you don't want to. It's up to you.
Yeah, thank you.
it's crazy. It's my first rodeo. I know. It is. I've never had to be like I would either, I've done some news and radio stuff, but and even in the midst of they were frustrated. So all of our PR team were aware of it and they wanted to do everything. So I just did behind the scenes.
Well, I couldn't think of a better person. I'm not sure how familiar you are with the process. There is there's a piece to it for various reasons. So the business director today, we're going to see it. So announced today There's some value to element of surprise. The parts will think I can't wait for my boss, our division coach, and I who just
Yes.
she was a hero of mine. She was very escape. She sent me a text last night. We were serving part of she sent me a text and said, see. And I was like, how did you find out? She was like, somebody from her division office told her, and I have no idea how that person found out. She doesn't do that. But the fact that we kept it quiet 12 hours before they go live,
Pretty impressive.
it's a big game. It's part of why we didn't share it. Part of why it's last minute. I'm waiting for my boss to promote you. All right. Good morning. How's everybody doing? It's not raining. That's a good thing for Middle Tennessee the last 2 months. At least I feel that's the case. So again, good morning. My name is Lou Caputo, and I have the privilege of serving as the CEO of TriStar Stonecrest Medical Center. I am pleased to announce TriStar Stonecrest's plan to expand emergency care access into Rutherford County through our TriStar Murfreesboro freestanding ER. For over 20 years, TriStar Stonecrest has proudly served Rutherford County. From the beginning, our mission has been to care for and improve human life. We have committed ourselves to providing residents with the highest quality care, and we continue to do so even today and plan to do so for long in the future. But right now, our neighbors in southern Murfreesboro have limited access to emergency care, and that works against our mission. When seconds matter most, we cannot risk long wait times or standstill traffic on I-24 and Murfreesboro thoroughfares. To address this access to care vacuum, the proposed site for TriStar Murfreesboro will be located at 2490 South Church Street, adjacent to the Barfield community. The proposed TriStar Murfreesboro ER is an initiative to ensure the city's growth never comes at the expense of what matters most, our health. Murfreesboro in Rutherford County has doubled in size since 2000, now having a population over 350,000 people. Some perspective. Our community is now the size of Hamilton County and Chattanooga. Chattanooga has over a dozen hospitals and 10 emergency room access points. The same cannot be said for our community. Murfreesboro is one of the fastest growing cities in Tennessee, yet its access to emergency care is very limited. With only 3 options for emergency care today, residents should not have to worry about waiting rooms at full capacity when this is the moment of life or death. Without accessible, high-quality emergency care for the residents of South Murfreesboro, our community will continue to be underserved as it grows. A freestanding emergency room, or FSER as we commonly refer to them, is a fully staffed facility intended to treat emergency services. Freestanding ERs have the same accreditation as acute care hospitals and often ease the burden on hospital ER waiting rooms and wait times. The FSER will serve as a satellite of TriStar Stonecrest Medical Center, a facility that has served Rutherford County for almost 25 years. Our staff will operate this facility that will have all the clinical capabilities of a traditional hospital emergency room. This will include exam rooms, trauma rooms, laboratory services, advanced imaging, and support spaces. FSERs, like traditional ERs, are open 24/7 and accept all insurance providers, including TennCare. Murfreesboro is growing. We all know this, and healthcare must grow with it. I would now like to introduce Dr. Colleen Tran, an emergency medicine specialist here at TriStar Stonecrest.
Good morning. My name is Colleen Tran. I'm an emergency physician here at TriStar Stonecrest Medical Center. We're here today to announce a new freestanding ER in Murfreesboro, and I'm excited for this opportunity to care for more Murfreesboro and Rutherford County residents. The need is there. The community has grown and changed so much over the past 20 years. With that growth comes challenges that impact the health and safety of our community. In an emergency, minutes matter. Heavy traffic and gridlock can waste precious minutes and seconds that can be the difference between life and death. Convenient access to care is essential. Right now, the healthcare structure of Murfreesboro and Rutherford County is lagging behind the rapid growth that this community has experienced. The ER will help manage that by providing a convenient access point to an area that is currently isolated from the nearest emergency care. As a physician, I have seen firsthand the consequences of limited healthcare options in the area. More people are moving here, yet there are not enough facilities to serve families experiencing emergencies. This ER would change that and allow us to better serve the individuals who walk through our doors. TriStar Health operates a number of freestanding ERs in the Nashville area, and all of them deliver high quality care. These ERs are held to the same standards as the main hospital ER and can provide many of the same services. In the event of a stroke, cardiac arrest, or trauma, this facility will be there 24/7, ready to save lives. This ensures that South Murfreesboro residents in Southern Rutherford County have access to high quality care close to home as their communities continue to grow. This freestanding ER will be a positive addition to the community and demonstrates TriStar Stonecrest's commitment to Rutherford County. South Murfreesboro needs this ER, so I hope that you will support us and bring this facility to the community. Thank you.
Thank you, Dr. Tran. I appreciate you so much. Appreciate your support and all that you do for this community. With that, I'll introduce LaShann Dixon.
Good morning. I am LaShann Dixon. I have the honor and privilege of serving on the Board of Trustees for TriStar Stonecrest. I also serve as the Director of the Office of Faith-Based and Community Engagement with the Division of Health Disparities Elimination with the Tennessee Department of Health. I am proud to call Murfreesboro my home. I am a Middle Tennessee State University graduate. I've worked here. My family lives here, and I worship here. I have witnessed our city's growth alongside with the challenges that growth brings. Healthcare development, especially access to and options for emergency care, has not kept pace with our community's expansion. Murfreesboro's peer cities, when we look at them, many of them have grown less extensively or not as quite rapidly, but have twice the number of available emergency care options. It is in this gap, healthcare access, right here in our own backyards, that has motivated me to continue my journey in public health. With a commitment to promoting, protecting, and improving the quality of life for people here in the state of Tennessee, I've dedicated more than 17 years of my public health career, serving in various roles, also serving as our local public health county director in the midst of the COVID-19 pandemic. And one thing that I've learned about our community is this: when we see a need, we do something about it, and we answer. Our community is calling us and calling out for more emergency care, and TriStar is answering. TriStar Murfreesboro's ER will help us to alleviate our region's need for care, ease the burden of hospital ERs, and provide accessibility to those who need it the most. Alone, we can do so little, but together we can do so much. These are the words from Helen Keller, which reminds us that real change happens when we come together. So I invite each of you in supporting me in this initiative that will help build a stronger and healthier Murfreesboro.
Thank you, LaShann. Thank you for your service on our board, but more so, thank you for your support and all you've done for this community. Off script a little bit, when LaShann was the director of the Department of Health for Rutherford County, had the privilege of working with her during COVID. And I knew at some point I was going to ask her to serve on our board because her leadership and her wisdom and her strength during that pandemic was remarkable. So appreciate all you do. Jen Beecham, please come to the microphone.
Good morning, everyone. My name is Jennifer Beecham. I am the Trauma Program Director here at TriStar Stonecrest Medical Center, and I'm honored to stand here with you today in support of the TriStar Murfreesboro ER. It has been a privilege of mine to have served and cared for the Rutherford County community for the past 10 years here at TriStar Stonecrest Medical Center and with EMS prior to that. I am so very excited that TriStar Stonecrest is stepping up to meet the needs for this growing community, which is not only a community that I work in, but it's also a community that I have lived in for the past 22 years. South Murfreesboro, which is where I live, is growing rapidly with no signs of slowing down. I can attest to this personally as the neighborhood adjacent to me is putting up new homes as we speak. And as our community grows, it is crucial that residents such as myself have access to life-saving care close to home. And on that note, I experienced this last year when my husband was having a medical emergency and there was not a ER close to us. So that just added to the stress of trying to get him to the right place. So I am so blessed and excited that now we will have easy access close to home, so much that they'll probably see me in there more than they want to, just to go visit. So as I stand here today, I just want to put that out there. As Murfreesboro grows, it is very important for residents of our community, a community that I love and live, that we have access to the essential needs and critical care that we need, and that it's close to our home and not having to fight traffic, as Lou has said, or I-24. So looking forward to the future, and it is bright. Thank you.
Thank you, Jen. You know I'm a crier, and so that is really mean to me in a public setting. For those of you that know Jen, talk about somebody who is passionate about improving healthcare in the community, what she has done for our trauma program, what she has done outside of our four walls with partnering with EMS, schools, civic organizations, just to educate on everything from Stop the Bleed to kids' safety is pretty remarkable. And to hear her personal story on top of her already enthusiastic passion for healthcare is meaningful. So I appreciate you sharing. As we come to a close, I look out from up on stage, just so impressed. The support for Stonecrest. I see political leaders, community leaders, our staff, our administration, folks from TriStar here. Cannot thank you enough for all you do to support Stonecrest in this community and our efforts today. Thank you for showing your support today as we embark on this mission to provide Murfreesboro with the emergency care that it needs. It's important to us. It's important to our mission. With your help, more life-saving care will be available when we need it most. Thank you for being here. Have a great afternoon.